Kids are out for vacation, which means summer sports leagues are in full swing. And although there's always a chance for concussions to happen, it's important to take the proper precautions. Caitlin Williams tells you more about the injury.
Soccer, football, biking, you name it, there is always a possibility for a hard hit to the head.
And the brain is encompassed by the skull, so the injury can lead to many things. You can have a fracture of the skull or a broken skull. You can have blood around the surface of the brain, or even blood inside the brain in certain areas of the brain.
A concussion, simply put, is bruising to the brain. To simplify it even more, imagine you have some bruising to your knee. A CAT scan, shown here, won't pick up that bruising, just like a CT scan won't pick up a concussion.
What we are looking for is if there's any bleeding or any fracture on the skull. If we don't see that, the brain may have a bruise on it, which is basically like a concussion. Just like that knee, if there's no broken bone, it's bruised.
But what lands patients underneath a CAT scan in the first place?
What we're going to do is, depending on what we find on their neurologic exam, we'll order this CAT scan where the patients will lie flat here on this CAT scan table, and the tray will go in this donut-shaped structure, and this allows us to view everything.
I'm laying here on the CAT scan table at Medical Center Hospital, and this is one place you don't want to be, and that's why wearing helmets is very important.
Now, what happens is many times the patient gets hit and they have a normal CAT scan, but that doesn't mean that their brain's not injured.
And in that case, the proper procedures still need to be followed even if the CAT scan does not suggest anything major.
You need to rest, and we often forget that. So often when someone has a concussion, they may be having symptoms of dizziness, blurred vision, they may feel sick to their stomach.
Dr. Bose suggests no texting or reading. This is a good time to do mindless activities like watching television. If you have been diagnosed with a concussion, see your primary doctor and don't just jump back into the event that got you a concussion in the first place. Reporting in Odessa, Caitlin Williams, News West 9.